Okay, welcome to part 2 of our respiratory system pathology lecture. Let's begin our discussion by discussing pneumoconiosis respiratory diseases. Remember, when you see the term pneumoconiosis, you should always think occupational lung disease. This is a group of lung diseases caused by occupational exposure, or in other words, exposure while on the job. There's 3 examples that we're going to discuss today: asbestosis, silicosis, and anthracosis. All right, let's begin with asbestosis. This is a lung disease resulting from the inhalation of asbestos particles that results in pulmonary fibrosis. Okay, so pulmonary fibrosis literally means scarring of the lungs. And that occurs, this pulmonary fibrosis occurs, the scarring of the lungs occurs as a result of inhaling asbestos dust. Exposure to asbestos has been linked to lung cancer, and the latency period may be 20 years or more. So in other words, when you're exposed to asbestos, it could take up to 20 years before you begin to notice this pulmonary fibrosis or notice signs and symptoms of a respiratory disease. The symptoms of asbestosis are dyspnea, remember difficulty breathing, dyspnea at rest, dry cough. Now this could be a productive cough if the patient also has a history of smoking, chest pain, recurrent respiratory tract infections. And again, you don't need to know the symptoms other than, shortness of breath and cough. I don't need you to recall all those details. I want you to connect asbestosis is caused by the inhalation of asbestos dust. And you can see these abnormal radiodensities here in the lungs. And again, this is occupational in nature and could develop into lung cancer. Good. Let's look at our next one, silicosis. Silicosis is a permanent condition of the lungs that is caused by the inhalation of silica dust. And in the Chippewa Valley region, we have several silica sand plants. Occupational exposure to silica dust includes certain types of mine work, sandblasting, or at some of the silica sand plants that we have in our area. Chest x-rays show patterns of nodules. So all these little dots could be considered nodules, the little white dots in the lungs, and it actually also causes lung scarring. Patients that have silicosis, and you don't need to write this down, are 3 times more likely to develop tuberculosis than people without silicosis. All right, so please just know silicosis is caused by inhalation of silica dust, and it's occupational in nature or pneumoconiosis related. As a student, you may see patients who come in for silicosis screening chest x-rays because it is a industry in our area that employs a lot of people. All right. Last pneumoconiosis respiratory disease that we'll discuss is anthracosis. Anthracosis is caused by exposure to deposits of coal dust. Now, with long-term inhalation of coal dust, say 10 years or more, it will spread, or it can spread throughout the lungs, and you see it on a chest x-ray as small radio-opaque spots or areas or masses, we may call it. So you're seeing one here, and you see a large one here. So another layman's terms for this would be black lung. You've probably heard of this. Coal miners may experience respiratory disease with long-term exposure. So this would be an example, anthracosis or black lung. And this certainly isn't necessarily something that we see here commonly because we don't have a lot of coal mines here, but certainly in other parts of the country, this is something that's more commonly seen. Again, it's pneumoconiosis or occupational in nature. Okay, Let's transition now to inflammatory lung diseases. Now, certainly this list that we're going to talk about today, pneumonia, bronchiectasis, tuberculosis, and histoplasmosis, this is not an all-inclusive list of inflammatory lung diseases, meaning there certainly are others. This is just the ones that I'd like you to be familiar with. Let's begin with pneumonia. So pneumonia is an inflammatory or inflammation of the lungs, and it results in accumulation of fluid within certain sections of the lungs, and you can see that circled here. So this is fluid within the parenchyma of the lung. And the X-ray, as you can see, shows this area of increased radiodensity, okay? This pneumonia can be viral, so caused by a virus. It can be bacterial, caused by a bacteria. It could be from aspiration, or it could be secondary from some other type of illness. A decubitus position, which we will look at in lab, may be helpful to demonstrate air fluid levels. And let me explain why. Let's say we take a look at this and we think, oh man, is that a large tumor? Or is that an infiltrate or inflammation in the lung tissue? If we lay the person on their side and let them lay on this affected side, so this would be their right side, if they lay on their right side for say 5 to 10 minutes and that's fluid, that will settle down, air will rise, and you'll see a definite air fluid level. So decubitus positions may be helpful in cases with pneumonia. Bronchiectasis. Bronchiectasis is an irreversible dilation or widening of the bronchi and bronchioles that may result from repeated pulmonary infection or obstruction. So let me pause right there. So look at these bronchioles, right? See how they are really distended and dilated? Okay, this is a permanent condition where they stay expanded and dilated, and you can see them. This is an axial slice taken during a CT scan. This is the right lung, this is the left lung. Okay, parts of the bronchial walls, and you don't need to write this down, parts of the bronchial walls are destroyed and become chronically inflamed, and that results in an increased production of mucus and causes chronic cough and chronic sputum. They'll be coughing up sputum chronically. Pus actually can collect in these dilated regions as well from the inflammation, and that's going to result in areas of increased radiodensity, so white on our X-ray, with less air in these regions. So it kind of makes sense. If there is an increase in pus, there would be less room for air in the lungs. All right, so please just know that bronchiectasis is a permanent dilation of the bronchi. This will result in increased mucus and chronic coughing. All right, tuberculosis. Okay, tuberculosis is a contagious disease that is caused by airborne bacteria. Okay, at one time, tuberculosis was reported to be the cause of 30% of all deaths. However, vaccines and antibiotics have nearly eliminated this disease. You don't have to write this down, but the incidence of TB is on the rise once again, however, due to the higher rate of other immune-depressing diseases such as AIDS, and in areas of urban overcrowding and areas with unsanitary conditions. So you can think of maybe third world countries, tuberculosis is still a concern. And as you know, we're tested for tuberculosis yearly. Okay, tuberculosis is often seen in the right apex of adults, but it can be visualized anywhere in the lungs. Let's take a look at this X-ray. Here is our right lung, here is our left lung, and you can look at this lung and see that there are increased radiodensities throughout the lung, so increased areas of white, but particularly we have a large area of radiodensity here in the right upper lung, okay? All right, so please connect tuberculosis as being an airborne bacteria. Okay. Histoplasmosis. Histoplasmosis is an infectious disease caused by inhaling microscopic spores. The spores that cause histoplasmosis are found in soil that has been contaminated with bird and bat droppings. Histoplasmosis is also an airborne infection. And you can see on our chest x-ray, histoplasmosis appears as calcified hilar and mediastinal nodes. Okay, so calcified means deposits of calcium. So calcified hilar and mediastinal nodes means that the lymph nodes in the hilar and mediastinal region have been encapsulated in calcium. You also see numerous lung nodules in this patient. All I need you to remember about histoplasmosis is it is a fungal infection caused by bird and bat droppings. Okay? If this is caught early, it's easily treatable. However, if it's not caught early and it spreads to other areas of the body, this can be fatal. Okay, we are going to pause part 2 here. We will pick up with COPD in part 3.